So welcome. We've got a lot on our agenda today, and I don't keep up with this sort of thing. I was asking Clyde before we started, is it St. Patty's Day today or tomorrow? Either way, happy St. Patty's Day. I think some of the folks in New Orleans have been celebrating a little bit too much, and guess what? We see significant amplification of transmission down there. So right now, can we go back and just start doing remote protected type of events and isolation? So today we're going to cover a lot of ground. We're going to talk about ACE inhibitors. We're going to talk a little bit about errors because I've seen several errors in this space. I made a couple myself. Again, let's focus on making sure that we look at what people are telling us and we make the best choice we can. We're going to talk about zinc. You've heard a lot about zinc. You've heard a lot about ACE inhibitors. You've probably heard a lot about chloroquine and maybe a little bit about hydroxychloroquine or Plaquenil. I've been working with a national retailer to set up a virus testing rollout in the US. We'll talk about that a little bit. And we also agreed to go ahead and start providing in-home care ourselves. Obviously, there's not a lot of me and my time to go around, but again, we're going to do what we can. So we'll talk a little bit about that as well. So first of all, let's go to ACE inhibitors. Now, you've heard a lot about those. I keep getting a lot of questions on it, and people said, Doc, will you please cover ACE inhibitors? I had a more in-depth discussion of ACE inhibitors, but here's the bottom line. You can find some of that on MedCram. You can find some of that in a bunch of other places. The Lancet has published a couple of articles with the theory. It's very interesting. You see a theory that ACE inhibitors are increasing risk. And in another place, you're seeing the theory that ACE inhibitors are decreasing risk. So what are we to do in that space? I'm going to talk about that first. The theory is that ACE2 receptors are being used by the virus. And that part's not, I don't think that's theory anymore. I think that's pretty well known. But again, there's confusion regarding positive and negative impact on with things like ARBs, angiotensin receptor blockers. Don't have to worry about that name. And especially ACE inhibitors, ACEI. That would be things like lisinopril, benazepril, ramipril. I've talked about ACE inhibitors many, many times because they work hand in glove in a multiplicative way to decrease cardiovascular inflammation. So here's the thing, should all these people that are on ACE inhibitors, like myself, ramipril, benazepril, again, basically any of the blood pressure medicines ending in PRIL, should we get off of those? If we're not on them, should we get on them? So here's the thing. As you see from in the lower right-hand corner, this is an image of the Lancet article saying, we think that's creating risk. I think you need to get off of them. I haven't seen any other significant bodies respond to it, but I'll tell you this one did, the European Society of Cardiology. Here's their position statement on of the Council on Hypertension, on ACE inhibitors, and coronavirus. And here's what they said. The Council on Hypertension strongly recommends that physicians and patients should continue treatment with their usual antihypertensive therapy because there is no clinical or scientific evidence to suggest that treatment with ACE inhibitors or ARBs should be discontinued because of the COVID-19 infection. Now, if you're one of those folks that's sitting there saying, yeah, of course they're saying that because they're a bunch of old reserved guys, and Brewer, you're always banging on medical practice standards committees as well. You should know that. I do, and I often do. And I do a lot of stuff outside the medical practice standards committees. I am not recommending right now that we switch away from ACE inhibitors or that we switch to ACE inhibitors. As you see from this picture, I'm trying to remember the name. I think it might be High Intensity Health. He's one of the guys that's saying, oh no, should we switch to ACE inhibitors? And I think he said he got his information from a brother-in-law that's a cardiologist. So again, we're all over the waterfront in that area. Do I recommend one thing or another? Pardon me for scratching my nose. Or Brewer, so you're a doc, you're on this, what would you do? Obviously, both recommendations are not correct. And obviously, I'm being careful. I'm continuing to study this. I will continue to confirm it before I make any changes. So at the end of the day, right now, I'm agreeing with the European Council on Hypertension. I am not making a change. And here's the thing. Look at this picture in the bottom right. This is a typical crowd scene. Everybody's panicked, or a lot of people have panicked now, and they're crowding the grocery store. My son's girlfriend spent 2 hours in a grocery store line the other night. So let's go back and think about this logically. Clear as mud in terms of impact of ACE inhibitors and ARBs. But what's not clear as mud is that standing in line, breathing the same air that other people are breathing is a risk. Don't do it. So do I want to, and who's going to be going to the pharmacy other than people that are sick or they're with somebody that's sick? They've been exposed to somebody that's sick. So do I want to start taking a chance and writing scripts for, or getting scripts for chloroquine, hydroxychloroquine, ACE inhibitors, switching off of ACE inhibitors, and then go stand in line at the pharmacy? Not quite yet, because here's the one thing, again, we do know. We need to slow down the curve of transmission. We need to remain isolated. So I'm continuing my social isolation. Not quite ready to start making changes. Now, the bottom line is I'm not knocking anybody that's made mistakes. I've made mistakes too. And in fact, I've made my own mistakes regarding this disease. I think it was early on, maybe a month or two ago, I said something about, I still thought it was probably going to be mostly what we call fomite infection or droplet, as opposed to aerosol. What does that mean? Bottom line was, I thought it was going to be stuff that you touch with your hands. Although that is a danger, it's clearly aerosol transmission. CDC has said that, other groups have said that. That's why it's transmitting so quickly. So in the air, as opposed to just hand to mouth. So again, go back, confirm everything that you hear. All of us make errors. Don't thump too hard, because again, nobody's perfect. But please go back and confirm, and then go back and think about, what do we know? What's theory? And what's the best course? Again, if you have risk, if you're a baby boomer, if you have high blood pressure, heart disease, diabetes, or as we've said, pre-diabetes, and most of us have that, don't go out right now. Let the let the younger people take the first waves of this virus and create what we call a little bit of herd immunity. So again, a lot of stuff going on in this area. We've talked a little bit about the crowds at grocery stores. I'm not again, I can't help but go into economics issues, but I'm not going to go there anymore. I've got other stuff I need to cover, like testing. Let me see what's next. Okay, yes, we are going into testing on the next item. I came to an agreement with a national retailer in the United States earlier this past weekend, also a national reference biomedical lab. I'm just a part of a much bigger team, providing some of the physician component on it. We do have plans to start offering the virus again. Testing for the virus. I'm not going to be the one making any kind of announcements. Expect to see announcements though later this week, probably Thursday, maybe next week, and with a projected rollout of or potential rollout, maybe Monday, Monday a week from today. Is it at no cost? Again, that's above and beyond my pay grade. What are the criteria for testing? CDC coronavirus testing criteria right now. And I believe any of the retailers that come out, like Walmart and Walgreens and some of the others that were announced by the president, I believe all of them are going to focus first on folks that have clear recommendations for testing. Well, obviously, the first two groups, there are three groups, and the first two I think should be pretty obvious. Someone who's been hospitalized with this problem. The second one is healthcare folks that have been exposed, and other folks who have been exposed to someone with known interest. They're called PUI. Person of, I'm blanking, haven't seen your moment on the U. PUI, person of interest, someone with potential infection. The CDC criteria for the third group, though, is what impacts us, and we're the group that, the viewers of this channel. Older folks, baby boomers, like half of this channel is up 55 and older. Diabetes, hypertension, cardiovascular disease, again, vast majority of the viewers of this channel. Immunocompromised, not standard immunocompromised, well, for any kind of immunocompromise for the CDC. If you look at our channel, it's not so much a channel for standard immunocompromises, but once you start digging deeper, most of us do have at least prediabetes, and that in and of itself impacts immune function. Obviously, hospitalized and healthcare workers were the other two categories that I talked about earlier. So now let's make another transition to another topic, zinc. Again, I had planned to do a much deeper video on zinc. Again, we're not going to have a lot of time to go into that today. The bottom line, though, is this. For you science geeks out there, the coronavirus appears to be dependent on an enzyme. And geek alert, it's called RNA-dependent RNA polymerase. Again, don't worry about it. But zinc appears to inhibit that enzyme. And you can go to MedCram. They've got a couple of really good videos on the science behind that. But here's the thing, again, zinc inhibits RNA-dependent RNA polymerase. So here's one of the science papers on it. Zinc inhibits coronavirus and arteriovirus RNA polymerase activity in vitro, and zinc ionophores block the replication of these viruses in cell culture. So in vivo, you may have heard it. There was a lot of stuff going, quote, viral, end quote, pardon the pun, not intended. There was a virologist that put a letter in his, I think on maybe a private family letter on Facebook, and it ended up getting public, and it was talking about decreasing coronavirus disease with zinc. So again, a lot of runs on zinc sources right now. Now, am I going to the pharmacy or the grocery store to pick up zinc? No, I've got some in my in that store. You remember I have an interest in supplements, so I'm taking that. It's not nearly what I'd want, but I just don't have it right now. Do I think it's worth going into a grocery store right now or a pharmacy to wait in line and buy that? Not at all. But here's the next interesting part of that story. It goes to the next topic, and that has to do with chloroquine. Chloroquine is an old, age-old, decades-old antimalarial medication. So why are we talking about chloroquine? Well, when you go back to some of that science about zinc, what we find out that it needs help getting into the cell. So even if you have you go to the store, or you're actually able to get some zinc, and you just say, okay, you know what, heck with all those guys, I'm going to load up on zinc. You get really high blood values. It really doesn't help that much, because you have to have the zinc needs help getting into the cell where it can be active on that enzyme, the RNA polymerase. Now, what helps the zinc do that? It's called an ionophore. Again, geek alert. An ionophore is something which helps something like an ion get into a cell. What's the ionophore for zinc? Chloroquine and hydroxychloroquine work very well in that space. So guess what? There's starting to become a lot of focus on not only zinc, but chloroquine, and even hydroxychloroquine. We'll cover that in just a second as well. But again, here's one of the headlines. In vitro antiviral activity and projection of optimized drug dosing design of hydroxychloroquine for treatment of severe acute respiratory syndrome, coronavirus 2. Here's another headline, which UK is banning parallel export and hoarding of 3 COVID drugs. So again, a lot of focus starting on these potential treatments. As we continue to talk about treatments, let me go back and remind people, which is better, treatment after you've got the disease or prevention? I mean, we talk about that multiple times per week. We've got 900 videos on that. And up until this point, we've talked about that regarding heart attack and stroke. Guys, it's the same thing with a virus. In fact, it's the same thing with everything. Let's go back, think about it, and prevent it rather than have to worry about what treatment works. Now, back to the comment, and well, why did I go there, and what's that all about? Isolation. I'm not going into the pharmacy. I'm not going into the grocery to get these items right now. Do I think that they're helpful? There's still a little bit of not ready for prime time here too. I said I was going to talk back to the treatments themselves, though, and the topics that we're going through in this agenda. Chloroquine versus hydroxychloroquine. Here's one of the articles. This was in Clinical Infectious Diseases. Comparison of hydroxychloroquine and chloroquine. What is hydroxychloroquine? Again, another age-old antimalarial drug. You may have heard it as Plaquenil. So bottom line, hydroxychloroquine appears to be significantly more potent than chloroquine in this space. Again, as I said, what is it? An old antimalarial drug. Zinc needs help getting into the cell. That's what these two drugs do. They're, again, for the geeks, an ionophore, a substance which is able to transport particular ions across a lipid membrane in a cell. In other words, they're the thing that helps the zinc get where it can help. Why not chloroquine? And are these ready for prime time? Again, I just mentioned both of those items. They may be ready for prime time. I'm getting personally very interested in these, and I do think that these have got a lot of potential for becoming tools as we go deeper into this pandemic and how the U.S. manages this at home. Speaking of the U.S. at home, so as you know, or maybe you don't, I am a physician. I'm a practicing physician. I see a significant number of patients, have been the medical director for a lot of different large staffs, medical staff, premise with 500 to 700 doctors, MDLIVE with over 800 doctors, chief science officer for anyhow. This is not about me. This is about providing some service for you guys. Here's the thing. Look at it and think about it. You're being told the safest thing you can do is stay at home. Well, if you're going to stay at home, how do you get health care? Again, I've been in the in-home provision of healthcare through telemedicine for a decade now. Our generation is the generation which stands to benefit from telemedicine more than any other generation out there. Yet our generation is also a generation that's grown up. We've got concepts in our head, and I can tell you, from talking to, I'll spend a couple of hours each week with Clyde and the call center staff. There are probably 10 or 20 people that I'll talk to that say, yeah, you know what? I would love to have a preventive focused doc, but there are none around here. And I just can't wrap my head around seeing a doc over the internet. So yeah, it's your life, your choices. But, and again, as I've said before, I can't, I'm busy. I've got a channel to run. I've got a lot of patients already, but I mean, these are extenuating circumstances. So I've already committed. I'm going to do what I can. Do we know how we're going to price it? Not exactly. Janice and Michelle are working that up. Do we know how we'll access it? Clyde and Janice and Tyler are doing some work on getting that set up. But again, as we continue to talk about how do you access care at home, the doctor's in. We're providing that for folks. And again, these are just some pictures showing where telemedicine's a big deal. Telemedicine has already been one of the biggest developments in stroke care. Look it up, telemedicine, telestroke care, big deal. They're doing surgery now remotely. I don't do that. The stuff that I do is mostly prescriptions and patient education. I did prepare some videos this past weekend telling how it works. I think one of the things that can help our generation, our viewers, get our heads around seeing a doctor from home using digital means. One of the things is to start seeing what is e-prescribing and go through with you the systems on how e-prescribing works. You know, we actually started doing e-prescribing when I was setting up some very large pharmacies for Toyota, gosh, well over a decade ago. And here's one of the things that people didn't realize and still don't realize. They think, oh, all of this digital healthcare is fast and loose, but it may improve access, but it's fast and loose. No, here, two of the biggest developments in quality have been very much associated with digital healthcare. One of them is e-prescribing. Guess what the biggest cause of of failures or pharmacy errors is? Doctor's handwriting. E-prescribing gets rid of that. So it gets rid of by far the biggest cause of errors in pharmacy. What's another big cause of errors? Again, doctor's handwriting in the charts. So electronic health records, big deal in terms of improving the quality of care. So what I've done is I did a couple of videos, one of them showing you how an e-prescribing system works. We obviously have one and use it. And also another video showing how digital healthcare records are developed. And we obviously have one of those. This is a picture of it. It's Practice Fusion. In fact, you may remember some of my videos, for example, when I share some of my own story as a patient, my CIMT, things like that. Those are coming out of screenshots from the Practice Fusion, our digital health record. So there we go. I think that does it for the slides. Let's go back now. And see what we've got going on. See if there's anybody there still listening. Oh yeah, we got a group. We got a lot of people. Okay, let's go to some, answer some questions. I used to think these are kind of silly looking old glasses, but that's a long story. And for those of you who are interested in them, we just watched the movie Love in the Time of Cholera yesterday. Very interesting comment, or a very interesting video. Little Viking Coach, good morning. Douglas D, the smart thing to do is abuse alcohol. Ted Davis, present and tardy. Bambi Abel, I'm taking an ARB, and intuition tells me that if there are limited receptors and I am blocking some, that would seem to reduce receptors that virus would bind to. Yeah, Bambi, that's a great point, and that's what's happening right now. People are going by intuition. You know, intuition's a great thing, and I think I agree. My intuition, I think, agrees with some of yours. We just don't have the proof yet. And as I've covered before, we've got some people who are using their intuition and coming to exact opposite conclusions. So are we ready to pull the trigger on that? Well, here's the thing. I know I've got a lot of people on ACE inhibitors. And yes, if you're one of my patients, you're on ACE inhibitors, you'd like to call and get switched over to another type of blood pressure medicine, I'll be happy to do that. And that's typical of my style. As you go, if you have an interest in our care, my style is not to be physician directed. As you can see in our channel, I often irritate the heck out of people because I don't tell people what to do. I give people the facts. I do the same thing with my patients. And here's the thing. So patients will like to hear this, and some of them say, you know, quit going on and on about the facts, just tell me what you would do. And I'm very comfortable doing that as well. That's usually the next step after we inform the patient. And I think I was pretty clear about what I'm doing, from what I would do, what I am doing with my own self right now. I'm not switching from my ACE inhibitors. I'm on benazepril. I was on ramipril until we started having a lot of, my local pharmacy started having a lot of problems accessing it. I'm on a combination of benazepril and a calcium channel blocker. I'm not switching right now. Number one, it's not really clear whether that makes a difference. Number two, so I do think the European Society of Hypertension is correct on this issue, at least at this point. I'm ready to change. And number three, I'm not wanting to go spend time waiting in a pharmacy waiting room. But again, back to my original point, if you're one of our patients, you're on an ACE inhibitor, you want to switch, call Michelle, call Clyde or Laura Lynn, go ahead and get an appointment set up. I'll be happy to start talking to you about that. Douglas D, no sugar or carbs, Wim Hof breathing and stress that immune system with cold. I stressed my immune system last week. For the first time, I did more of a 7-day. When I knew I was going to be coming in and social isolating, I said, you know what? I have been working for over 2 months without a significant fasting. I've actually even started dropping my 2-day fast for a while. So I did a combination. I did a full 7 days, started off with a 2-day water fast, and then did a 5-day low calorie fast. It's more like 700 calories per day for 5 days. And I got very hungry. The last hour I was actually seeing a patient and had to cut off. I usually go on beyond the hour with the patient. I couldn't with this one because I started getting a hypoglycemic episode. Bottom line is, yes, I'm doing a little bit of fasting right now. And yes, I do think that fasting always makes sense. John, and now get into the question of, does it make sense right now with potential exposure? I don't think I'm potentially exposed right now. I'm staying in my home. John Tocho, Dr. David Sinclair has been busy researching since his Harvard lab closed down on Friday. His Twitter feed is very interesting. Thank you, John. Douglas D, cold showers, ice baths. Karen Block, my husband's getting a macular degeneration eye injection as we speak. Should he wear goggles around people? I would. Well, especially in the healthcare environment. I've been back and forth about this issue. The CDC doesn't recommend goggles unless you're sick. But again, as you start getting into a healthcare environment, I think you can assume that there's very likely to be some sick people there. Little Viking coach, cold showers raise cortisol, which weakens the immune system. Douglas, the exact opposite, Viking. Little nope. Okay, so Douglas D and Little Viking are going at it with their debate. Let's see. Gosh, guys. Guys, can you be nice with each other, please? Bart Robinson. Exactly. Ken Seifert, Doc, do you believe this is a manufactured virus? That's a great question, and it's a great theory. And you know, like many people believe that they were doing some biological warfare research in one of the labs, I think maybe near Wuhan. And then I heard that, you know, somebody took some of those animals that was cleaning the biological warfare lab out and sold them at the local wet market. Here's what I believe. I don't think we'll ever know. I mean, we could find out. If the person that did it, do I think that person's ever going to fess up? No. Do I think that, I don't think they did that. I don't think that's what happened. If it did, well, I'd start to get into political and stuff like that. I'm going to leave that alone. Bambi Abel, ionophores for zinc also include quercetin and EG. Yeah, they do. At what point would you go into the store? Wife and I will have to go sometime in a few days. Well, you know, you go when you got to go. I do a little bit more fasting and try to wait at least another week. As I've shared many times, my wife and I don't always agree on everything. And I'm geared up personally to go for over a month. Now, I don't think she's going to make it that long. In fact, I wouldn't be surprised if she goes in this week. But she and I are having some heated discussion, argument about what she does to prep before she goes in there. And the big thing is infection control while you go in there. Great question, Bambi. Bob W, prevention, of course, but what if I get it? We need to talk both. Absolutely, Bob. And let me just say, I think you heard me talk about both. I think you heard me talk about zinc. I think you heard me talk about not only chloroquine, but Plaquenil, hydroxychloroquine. I think you heard me talk about ACE inhibitors and what to do about those. So I agree with you. You got to do both. You can't just say, okay, we're going to take the high ground and all we're ever going to do is prevent. Right now, though, there's some clarity. Whenever it's clear, I wouldn't take something, pardon me to repeat the point, but again, if we're talking about theories on zinc, hydroxychloroquine, chloroquine, ACE inhibitors, right now, I don't think any of those hold as much water as do I want to go in and break my social isolation to achieve one of these theoretical advantages. That's my point, and I hope that's helpful. Okay, what about increasing zinc intake? Well, again, I think we talked about that, but we also talked about zinc. You can increase your zinc intake to a huge amount, increase your blood value for zinc, and unless it can get into the cell, it's not doing much good. Okay, so what about an older antimalarial quinine? That's an interesting question, and I don't know the answer to that. Is that any help to zinc? Again, I don't know the answer. Ken Seifert, I remember during the Spanish flu, they moved patients outside into the sun. Bambi's taking supplemental zinc. Lori B, why does baking soda work against viruses? Don't know the answer to that. Gigi, good to hear from you, my friend. Gigi's also been taking supplemental zinc for immune support as a regular protocol. I have too. I'm running out fairly soon on my zinc. Am I going to make a special? Well, I'm not going to repeat myself. I'm not going in just to get re-upped on my zinc. What I plan to do is try to get some from Amazon. It's a little bit more controlled environment, bringing in a package from Amazon than it is going and having to wait hours in a pharmacy or grocery store line. And hopefully within a week or two, it won't be a protracted wait in these lines. Chero Sullivan, I have COPD, but so far there are no cases in our town yet. I do live in the country, but so far I'm still shopping and going to church. Well, see, here's the thing, Chero. If you wait until there's a case in town, the transmission's been going on for a while. Please think about that. I mean, we all keep saying, well, we're going to wait till there's a case. Well, how much transmission is going on before the first case is known? Please think about that. Tom Goodlett, what about BHT? I'm not sure. How about using silver solution? Gigi, my husband's scheduled for a knee replacement surgery. Receptionist won't comment, but said it could be questionable. Do you advise that he wait on? Yeah. Do I advise that somebody wait on a knee replacement? I advise that people wait on everything right now. I advise that you wait on getting milk. I advise that you wait on going on your next cruise. I advise that you wait on going any kind of elective surgery, if at all possible. Guys, every week we can give this. Just the amount of knowledge and control that we have over this situation. I don't have to, I mean, I'm not over this situation is another week where the amount of information and control multiplies. So if you can wait another week before you make some of these decisions, please do. That's what I'm asking my wife to do. And as you may remember, she's kind of hard-headed. So we'll see how far it goes with her. Andre Maishi, hey doc, can colloidal silver 10 parts per million kill virus? I'm not an expert in that area. I think that colloidal silver can help. Would I recommend taking it by mouth? I'm not there yet. I don't see colloidal silver as a major candidate for oral treatment. Yeah. Again, it's not my space. I'm not. Don't know that stuff yet. It's an interesting thing, but I'm not the guy to tell you about that. Okay, Cheryl Sullivan. I went to Kroger early this morning and it wasn't too bad. Got milk and pet food I needed. Well, good. I think one of the most important things, if you do go to the grocery store, obviously you want to wash everything when you get home or wipe it down with appropriate alcohol preps. Here's one of the key things. Don't spend as little time as you can in there. Don't go in and wander around. Again, this is an aerosol transmitted virus. You get it by breathing air that people with the infection are breathing. Richard Lund, I'm taking EGCG 95% that I used to sell. Good for you. Thank you for sharing. Gigi, try not to let the 24/7 media spook you too much. Stay grounded in reason and remain calm and wise. Virtual hugs. Thank you again, Gigi, and thank you for that comment. I was telling people I started asking my church, lobbying my church to close down activities over a week ago, and I got a lot of people that thought I was a nut. I've never been emotional about this. I'm very confident that we're going to do what we need to do. I'm very confident that it's not going to wipe out mankind. I'm very confident that we're going to do some great things. What I do want to do, though, is make sure that people are aware of what they need to do next. And so I have gotten emotional in terms of trying to get information out there. Meanwhile, the algorithm and our own problems with technology continue to get in the way. So that's a problem. But thank you again, Gigi, for making people aware. Yes, there were bad problems in China. There were obviously also bad problems in Italy. But we've already seen there are different ways of managing this problem. And the way we manage it makes the world of difference in terms of of the outcome. So yes, please stay calm. This is something we're going to get through just fine. Will there be deaths? Yes, there will. How many there are depends very much on decisions we make about things like, okay, well, I'm going to go to the grocery store, or okay, I'm going to get my surgery. I saw a physician YouTuber who I, for the most part, respect quite a bit, took off to on a long trip with her family and was saying, you know what, I'm keto, so my family has very strong immune systems. We're not worried about it. I don't think that was the right choice. This is not about 50-year-old parents or 40-year-old parents and 20-year-old kids. This is about protecting the 60-year-olds, the 70-year-olds, especially the 80-year-olds, the parents of those parents. And it's also about amplifying transmission. So again, the more we can slow this process down, I think the better we are. And slowing it down requires that we think rationally as opposed to emotionally. Walter Ski, good to hear from you, Walter. Does the taking of temperatures of individuals tell you much other than a virus is now symptomatic in that individual? That's about what it tells you. It tells you, again, and the keyword, not only does it not tell you for sure if there's a virus, because during the incubation period, you're not going to have, you may not have temperature or fever. A normal temp person could still be spreading active COVID if they have it, correct? How much they are, that's actually a good point. I think it's really clear that there are things called super spreaders. Super spreaders are people that have no symptoms. They do not know they're sick, and yet they're going around for 2 weeks spreading this virus. So yeah, that's a really good point, Walter. Thank you very much for bringing it up. Ken Patu, Ken, I was getting ready to read your question, but it's this same old YouTube tech stuff. I hit it to try to see it, and then it just adjusted. I can't find it anymore, Ken. I'm sorry. Oh, here we go. Can you discuss myocardial specific effects of COVID-19? My understanding is that it impacts endothelial cells directly. Gosh, I wish I could, Ken. I can't today. Hopefully within a few weeks, we'll settle down to some of the deeper science. And I appreciate your interest in the deeper science. Mark Mache, in fact, I'm not that clear on it right now because I'm focusing on practical stuff like helping people understand how and why they need to socially isolate, you know, and some of the other things we just talked about. Mark Mache, high zinc intake causes copper dysregulation. Oh, yeah, zinc and copper are very much intertwined in terms of their regulation. So that, like, you know, let's assume that is a solution. Zinc turns out to be. Just like everything else, every good solution creates a whole new set of problems, doesn't it? So Richard Lund, $700 a kilo from China is what I paid for the raw material of the EGOG 95%. I have some 70% somewhere. Well, thank you, Richard. Gigi, thank you much. Walter Ski, this morning, Uber CEO says they are waiving the delivery fees for independently owned restaurants with Uber Eats. Well, that's good, I guess. I had one of my viewers say, "Look, we do takeout all the time. So isn't takeout better than going into the grocery store?" Well, let's think about it. I make one run to the grocery store, and literally, at least for battening down the hatches and going into social isolation mode, I can cover at least a month's worth of food. If you're going to get every meal from delivery, you're going to have somebody, a delivery guy, walking up and maybe breathing in your space, what, twice a day, once a day, for at least 30 times that month. So is delivery really that much safer than getting all your stuff at once and going back into hibernation mode or isolation mode? I think that's a good question. I don't think so. John Tucho, we've had live stream church services last Sunday. We're great. You know, John, given what I do, and obviously given what we're doing right now, I suggested to my church, guys, can we just wrap our head around doing Sunday school on live stream and church on live stream? We do have some digital access for live stream for big church, quote, big church, but we haven't done it yet. Our other teachers on, I'm a teacher and one of our occasionally pinch hit as a teacher for our Sunday school. I encouraged our main teacher, still having a little bit of trouble wrapping his head around it. And I'm considering just, you know what, let me teach a couple of classes and me doing it from live stream. Because again, our generation is not used to going to the doctor digitally. We're not used to going to church remotely. We're not used to a whole bunch of things remotely, but we need to. And in fact, you know, there's several silver linings to a lot of things. And I think one of the silver linings for our generation may be that we began to wrap our heads around. We can access a lot of things remotely that we just haven't thought about. Thank you, John Tocho. I appreciate that comment. Derek Sagima. Hi, Dr. Brewer. Any reason to fear a shortage of chloroquine or hydroxychloroquine if it turns out to be a solution? I missed whether your chloroquine zinc is possibly preventive or possible treatment. Again, I think it's a little bit too early to tell. What do I think personally? So, I mean, that's the information. And let me put up a caveat. What do I think personally? I suspect it may actually become a real issue in both perspectives. I've begun to start looking up different sources for hydroxychloroquine. I started to say I've looked at some stock in a couple of hydroxychloroquine generic manufacturers, but this is not that kind of channel. Richard Lund, my uncle in Texas contracted it 3 weeks ago, 3 days on the ventilator. Oh, now recovered though. Congratulations to your uncle. And I'm so glad that it didn't happen to him at a time when there were no ventilators available. And that's the goal, folks. Keep it slow enough to where we always have ventilators available for people like Richard Lund's uncle, for people like you, people like me. Continue to slow it down. Don't panic. We know what slows it down. We know how to do it. Thank you. So, Skunk Ape, interesting name. Can I go to the dentist today? Skunk Ape, of course you can. I don't tell you whether or not you can go to the dentist. I can tell you I wouldn't. Actually, as you know, Doug Thompson is a big friend of mine. He's a major dentist. He's got the Wellness Dentistry Network. He and I were talking about this. And obviously, he's got a lot of people that aren't going in right now. And I wouldn't either. Again, I touched the questions, the live chat over here, and when I did, it just took off, and now I'm lost again. So We'll start here. Nana Buster, I need a prescription renewal from my doctor. How should I prep for office visit? Why do you go to the office visit? Why don't you call them? Cheryl Sullivan, my daughter that lives in Maryland said they just shut down restaurants and other businesses. That's correct. Maryland's not the only state that's shutting down restaurants and other businesses. Again, we're not the only people that are figuring out that if we slow down transmission and public meetings and stuff like that, we'll slow down transmission. And if we slow down transmission, we will retain control of this problem. That doesn't require panic, it just requires action. Okay, Hydrick. There was a woman that went on a trip. She called ahead to the hospital to let them know she was coming, so they were ready. Well, I guess that's helpful. Great advice, Doc. Thanks for your podcast. That's Tag Daddy 56. Thank you very much, Tag Daddy. I appreciate it. As many of us know, I've retired 2 or 3 times. And at this point, I'm putting in as many hours as I ever did. Maybe not some of like the first 2 weeks of my internship back at Charity Hospital in 1981. And in some other phases of my life, I've done quite a few all-nighters. I'm not doing all-nighters right now, but I'm working weekends, working 16-hour days, and I'm having a blast. I mean, here's the thing. Thank you for your comment, but let me give you, and I know this is not about me, but I got to say, I'm having a blast. It's like that old movie Warhorse, I think. I didn't see it, but here's what I feel like. I feel like, you know, I grew up and trained in public health and prevention, and done in a ton of outbreak work. For example, way back when I was in Maryland, I was very much involved in the HIV, we called it then HTLV3, the AIDS outbreak, the AIDS epidemic. I remember I did a lot of work in that. I was on the Maryland Governor's AIDS Task Force. Just a few years ago, I helped, did the development for Toyota. Remember, I was the North American medical director for Toyota for about 10 years. That was when we had a couple of flu pandemics come through or threatened to come through. Developed that pandemic program. Because of that activity, was on the Kentucky governor's task group for developing Kentucky pandemic awareness and countermeasures. And it's like, here's the thing. Whenever I was just on an airplane a couple of years ago, and happened to sit next to a CDC person who is involved in flu and other viral diseases. And when we found out what each other does, I used to have EIS officers like her come up and train with me when I was running the program at Hopkins after they did their EIS work. And so we started talking and she started sharing with me. This is an incredibly interesting thing. And you can find out all you want, tons of details in a book called Deadliest Enemy by David Osterholm. David is, he had a great video and interview with JRE, Joe Rogan Experience, just last week. Clyde, if you can find that and post that, I'd appreciate it. He's got a great book called Deadliest Enemy. You can get that. I just reread it, read it the other night, and fantastic book. And he quotes Rudyard Kipling as saying something like, "And the thunder came in the dawn out of China over the bay." And he's talking about, we've known for a few years, coronavirus could be this 100-year pandemic that we've all been waiting for. So on a professional basis, I could not be more energized, more excited about the potential for continuing to have an impact. Like I said earlier, I'm working with a couple of national groups, a national lab, a national retailer, to make coronavirus testing available. We've got this channel. we're making, we're opening up my hours to the extent possible. If we get a lot of takers on the care that we're making available, I've got a couple of docs who are very interested in joining me. We've got a bunch of nurses who are very interested in helping as well. So I'd love to get that up and rolling and start scaling it. Thank you again for your comment, but and thank you for your recognition in me doing it. But I have to tell you, it's reward in and of itself. I'm having a blast. Please, everyone, be careful of getting your mail out of your mailbox. This is Cheryl O'Sullivan. Yeah, very good point. Gloves and Lysol might be a good idea. Good point. Gigi, there's a good comment. That's a good comment, doctor. Manage with smart reason and then minimize risk taking. Thanks, Gigi. Sandra is my niece. Sandra Sterling. Hello, Sandra. Good to hear from you. What are the negative side effects of Plaquenil? There are a bunch of them. If you're on Plaquenil especially if you're on it for like 5 years or more, you start having to get looking at the retina to see if there's been pigment damage to the retina. It can cause blindness. Plaquenil is to quote my wife's least favorite president, Plaquenil, he quoted this about somebody else, but Plaquenil is a tough hombre. It is a difficult drug. So I'm glad you brought that up. I mean, I talked to quite a bit about Plaquenil and, in other words, hydroxychloroquine and chloroquine a few minutes ago. These antimalarial drugs are very challenging. They are probably, I don't know if they're used more for antimalarials than they are for lupus and arthritis, but they're used very much for, again, lupus, I think for rheumatoid arthritis. They're used for a lot of things, and they are bad. They cause significant problems. Interesting note, especially for people on this channel, they can also be used for diabetes. Hydroxy, and here's the connection here. You ask about side effects of hydroxychloroquine or Plaquenil. It can cause decreased blood sugar. It tends to cause some increased sensitivity to insulin, and it appears to cause some decrease in degradation of insulin. So if you go to India, for example, the Indian authorities have authorized Plaquenil for treatment of diabetes. Interesting, huh? You know, the more, I listened to a video this weekend. It was by Kevin Bacon, and it was about the 6 degrees of Kevin Bacon. And, you know, that exists with medications as well. So here we are. Plaquenil's got a couple of different connections back to diabetes. That's getting a little bit far afield. Thank you for asking the question. I'm going to move on. Little Viking Coach, Ford, remind people to eat fermented foods like sauerkraut. I've got a refrigerator full of sauerkraut. I've got sauerkraut to last for another 2 months. Raw milk, kefir, great probiotics for immune system. Thank you, Little Viking Coach. And this, oh, Kevin McCord. Kevin, thank you for joining. Kevin, by the way, is a physician, very much in touch with the preventive space. The course of COVID-19 starts out mimicking many other common respiratory illnesses until patients decompensate several days in and develop respiratory distress. Thank you, Kevin. And again, thank you for your interest in the good work that you're doing up near Cincinnati. Senile Canuck, have I already missed ACE discussion? Yes, you have, Senile. What I would suggest is that you gear in. We found out that our last video, live video on Friday, actually ended up going into unlisted or private mode. Hopefully this one won't. So you can go in and look at the coronavirus and ACE inhibitor story. I'll give you a 10-second review though. Some people say ACE inhibitors help and ARBs, ARBs and ACEs. Others say they make it worse. Here's the question. Are you feeling lucky? Do you really want to make a change right now in your blood pressure medication? And do you really want to go wait in the and take known risk by breaking your social isolation of contracting the disease while trying to decide something that's not proven yet? One of the large groups in the European standards committees, the European High Blood Pressure Committee has said, look, we don't think there's an association. There's no clinical association. There's no scientific association. There are some associations. The question is whether they're strong enough to create action, and I do not think they are. So hopefully that was helpful. Rick Sanford, I'm confused. I take lisinopril, but only when I need it. Should I move to every day? What would you be taking lisinopril only when you need it? And when do you need it? Don't understand that. Usually people are taking lisinopril for high blood pressure. Again, in the past, as we've managed people on a heart attack and stroke prevention mode, we have looked for an opportunity, at least some moderate decrease in blood pressure, so we could give an ACE inhibitor, because it is multiplicative in effect in terms of decreasing inflammation along with low dose statins. So Rick, I'm confused about your question. You know, if you're saying only when I have high blood pressure, then that's still also confusing me. Okay, Northwest Frontier. I open my mail outdoors, throw most of it away, and sanitize whatever I'm planning to bring into the house. Think how to keep your home free of the virus. Thank you, Northwest Frontier. If you want a shorter watch, John Touchove, if you want a shorter watch on Dr. Osterholm, go to Care 11 in Minneapolis. It is 14 minutes long. Yeah, but it doesn't cover, I'm sure it doesn't cover all the stuff that, thank you for your suggestion. Jason Stanley, age 70, last week I canceled all dental and medical appointments. Good, it's time to be responsible. Thank you very much, Jason, for making that statement and taking that action. The medical system can't handle the people you will infect by going out on minor things. Let me repeat that, Jason. That was a great comment, and it's what I'm continuing to run into. Well, you know what? My Tai Chi group is going to have it in a larger auditorium, so we're not breathing each other's air. Or we're going to have it outdoors, so we're not breathing it. You know, can you just take a couple of weeks and listen to Jason Stanley again here? Jason Stanley says, age 70, last week I canceled all dental and medical appointments. It's time to be responsible. The medical system can't handle the people you infect by going out on minor things. Thank you again, Jason. Okay, Michael Frost. Hi, Doc. I live in Austria. Michael, I don't think I have met, we've met a subscriber yet, or a viewer from Austria. Oh, yes, we have. Our very first viewer, and I'm blanking on his name, years ago. But thank you very much for commenting. Here and across Europe, the cases are surging. Yes, they are. Huge issues. In fact, I read last night that the police are starting to come out and fine you in Austria if they find you congregating with more than one person. They say the virus mutated versus the China version. What is your view on this? Lots of young people in critical condition. So my view on mutations, yes, that's not unusual at all. I'm fairly sure that there's at least one mutation, and I think there are probably more. And I think that will come out as we continue to learn more about what's going on with this pandemic. These viruses mutate fairly readily. All viruses do. So that's something that you shouldn't expect as we continue to go through this pandemic. CTP, if you monitor blood pressure, would you see a noticeable change if you contract the virus? No. Could this be helpful tracking along with temperature? No. It's certainly nothing I've heard of. It's nothing I would expect. Of course, once you start getting into really bad problems, your blood pressure is going to be affected, but you're going to have much bigger warning signs before that. John Berkeley, what about ACE inhibitors? John, we've covered it 3 times. The short story is there's a lot of focus on those right now. There's conflicting evidence. Do you really want to go make a switch right now and go wait in the pharmacy line? I take an ACE inhibitor, I take benazepril, and I'm not making any switches right now. But but there's a lot of logic behind it, and I'm clearly keeping my eye on it. And I've clearly used this this video. And Clyde, by the way, we need to send an email to our patients, letting them know if they'd like to see me about that. I'd be happy to talk to them.
Okay,
Northwest Frontier, Michael Frost, that sounds like fake news, prove it. Oh, no, it's not fake news. There are mutations. Mutations happen all the time. Chinese Chernobyl, it's madness. Gosh, we had one of these changes again. Kevin McCord, thank you for the information today about the ACE inhibitors and ARBs. Thank you, Kevin. Dr. McCord. Sina Canna, thanks so much, Doc. Pretty much the decision I'd made. Thanks for putting the hype aside. Michael Frost, Northwest Frontier, the suggestion of the mutation comes from the Vienna Medical University. This is not, I don't think that's fake news. John Tucho, 14 minutes versus 90. I watched both. Good idea. Rick Sanford, my blood pressure some days is high. And so I guess you're taking the medication, the lisinopril, when it's high. We're about to get to the end of the questions, folks. If you have any others, go ahead and put those down. I'm going to see if I can cover most of these before I leave today. And Northwest says, when I see it somewhere credible, I'll believe it. Okay, that's fine. Harry Hindeleiter. Hey, Harry, how are you doing? Here, another thought about fast food delivery is the health of all the folks who prepare the food. Seems higher risk than home prep. Yeah, I didn't even go there. Really good point, Harry. Thank you for bringing it up. Patty Ann, Dr. Michael Osterholm, not Dave. Oh, what did I say? David? Gosh. Again, another error. Won't be the first. It clearly wasn't the first and clearly won't be the last. Thank you for fact checking me on that. It's not, and I knew that. It's not David, it's Michael. Speaking of Michael, we've got Michael Frost. Yes, police are instructed to stop gathering of more than 5 people. That's in Austria. Reservists of the Army were deployed. The whole country is in lockdown since today. John Tacho, Dr. David Sinclair Twitter feed worth looking at. Thank you, guys. A lot of interesting comments, a lot of interest today. And obviously, I got a lot going on, and I'm really enjoying having an impact. Wish I could just spread it a little bit more. Talk to you later. Oh, wait a minute. We got a couple other real quick ones. We got a spurt of them. I think you're just now getting through the loop and hearing my comment about questions. John Berkeley, thanks. I'm taking lisinopril and amlodipine already. Yes, I am as well, John. Do drinking green tea, lemon, and honey help the immune system? It's debatable. I think it probably does help. Am I hanging my hopes on green tea to help us prevent and fix that? No. Am I drinking green tea? Yeah, I'm drinking a lot of green tea and a lot of gymnema tea. Those of you who know a little bit more about my history, I'm a sweets addict, and I'm trying to break that sweets addiction. So I've gotten some gymnema tea, and that's my go-to tea drink these days. Okay, Clyde C. Oh, thank you, Clyde. Clyde said, search on this YouTube. Joe Rogan Experience, number 1439, Michael Osterholm, 1439. And again, his book is Deadliest Enemy. Very interesting book. It's a long read. If I can ever get my head out, head out from under all the other stuff I'm doing, I would love to do a series on Deadliest Enemy by Michael Osterholm. It is a great book. He's been in CIDRAP, the Center for Infectious Disease Research, and I think in programs. It's a CDC program. It's his position is in Minnesota. He evidently grew up in Minnesota. He tells a lot of interesting stories. He's been the state epidemiologist for a long time. So he's been very much involved in these kind of things. He's consulted in groups like the King of Jordan for MERS, Middle East respiratory syndrome. See, the thing with MERS, and you may not know this, it's like many of these coronaviruses, it appears to be endemic among bats, meaning stable transmission within bats. It also appears to be maybe endemic or maybe a happenstance host with the camel population. And if you think about camels in the Middle East, there is no way we're going to eradicate that. I mean, camels are like, they have camel racing. Some of the camels are as expensive as the $10 million horses that they sell at Keeneland, just 2 miles from me. And obviously camels are a big deal for other parts of the Middle Eastern economy. MERS, the coronavirus, one of the versions of the coronavirus is endemic right now within the camel population. So there was just no question that there was going to be an outbreak in this space. And one of Osterholm's big issues was we have all these warnings as a culture. We know it's endemic. We know it caused SARS a few years ago. We know it caused MERS before. We know we're waiting for a pandemic. And again, he called it. He even said, well, I think it's going to happen. I think it's going to be coronavirus, and I think it's going to come from China. He was right on each one of those items. So that's why that book is so interesting. How did he know it was going to come from China? Well, one of the big issues here is eating exotic foods, wet meats, wild animals. And what better way to get exposure to a virus than to capture, kill, prepare the meat, and eat a bat or a civet, which eats bats, et cetera, et cetera. I shared this a couple of weeks ago, some of the pictures associated with these wet markets. Very interesting cultural activity. Farouk Farr, good to hear from you, Farouk. Farouk is in Iran. Dr. B, it mutated here in Iran. It is totally different properties, attacks kidney first with no symptoms. That's interesting. I had not heard that. Michael Frost, North Frontier, go to Italian online media pages and check it out. Doctors are alarming all the EU countries. Take this stuff serious. Do not mix it up with the flu. Farouk, some dead patients are negative for COVID-19 tests. Well, that's interesting. Okay, again, thank you very much for your interest, and I think we are slowing down on the questions at this point. We're going to sign out and get to some other work.